Lightbox believes very strongly that art makes you feel better. This can range from the 15-minute visit in your lunch hour to get away from the computer, to a scheduled programme of work, working with a particular target group. Our work with those with mental health needs is such a programme. It's been run here for the last 5 years, and the results have been really significant. The extent to which the project has been valued and has become an important part of participants' lives is really humbling. Ways have been found to transcend the fractured nature of people's lives. We wish to put to good use all the expertise and experience that we've developed over 5 years. We have made mistakes, but we found solutions, and we now believe we have a model of good practice. We're ready to extend that to a new group of people who we believe we can truly help their quality of life. People with early stage dementia have been seen to benefit greatly from arts activity, and we want to extend our reach to those people. We all walk down the street and momentarily cannot remember the name of the person coming towards us. We go into a room and we can't remember why we went in there. For a split second in conversation, when someone asks us what we did last night, we can't remember. But imagine if this was the way you felt all the time. This is what those with early stage dementia have to cope with, and those that they love have to live with. As this slide shows you, dementia is a frighteningly large and growing issue for society. And I've simply used our own county as an example. People with early stage dementia are isolated. They can become cut off from the everyday world. But in reality, they love discussion, they love the stimulation of interaction. Short-term memory fails, but there is a great deal of evidence to suggest that long-term memory remains intact and can be stimulated. The chance to share stories, to share memories alongside art activity is a really powerful one. Participants say they feel much happier after an afternoon of art. Phil, a recent participant, comments, "It's much better than thinking the world is going on and you're not." People with dementia pull back from social engagement simply from fear of embarrassment. Their social circle shrinks. This leads to a decline in their cognitive stimulation, and the spiral goes ever downwards. Art activity is a really socially acceptable intervention, a normal activity that people with dementia and their carers can do together. We want to provide the opportunity for 10 participants and their carers to attend fortnightly sessions led by an experienced artist in our great building using the wonderful Ingram collection. Activity includes painting, drawing, photography, sculpture. We are very aware of the riches we have here, and the aim of our organisation has always been to use these riches for the good of every aspect of the community, not just middle-class art lovers. Working with those with dementia has to be delivered on a really small scale. Many participants become very confused in large groups, and the interaction between the participants is vital. These activities are really difficult to find funding for because the cost versus benefit appears very high. Regular activity is known to assist dementia sufferers as it creates an order in an otherwise rather incoherent life. So we'll also provide activities that the carers can deliver at home, so it can become a daily activity. It's a simple kit of materials and simple tasks. We want the activity to become sustainable, so we are going to build in a programme of training with our staff. They will work with our volunteers and pass on the skills So ultimately, the volunteers will be able to run the programme. Our assets here are a happy, welcoming, safe environment, an amazing art collection, and the experience and the learning which is part of my mental health work. To this, we just need to add a small amount of seed funding to help disprove the stigma that dementia sufferers do not have a thinking, feeling brain. We believe they can continue to be highly creative individuals. We want to provide a case study that others can follow and join into partnership with other organisations. It's been said that if we could get health economists to show that this kind of activity keeps people out of care homes, it would be snapped up by the NHS. Sadly, that isn't the case, and that's why we ask you to support this project this evening. Thank you.